Okay, good afternoon, everyone. My name is Dr. Mero Salinas, a Lincoln University in Missouri, Extension State Specialist. As part of the team here in this ruminant is Dr. Mohan Acharya, also Extension State Specialist. And we have now as an invited speaker Dr. Yalonda Burton, coming from Oklahoma. So I will give the time for her just to tell us a little bit who she is and what she's doing right now. And she will be having a very, very good presentation. Go ahead, Dr. Burton.
Thank you very much. I appreciate the opportunity to get to talk to everybody. I'm Yalonda Burton. I'm a doctor, a veterinarian in Stilwell, Oklahoma. We're just about 5 minutes from the Arkansas border and probably about 30 minutes from the Missouri border. So we can get to either of those states pretty fast, even though I am in Oklahoma. I have a small animal and large animal practice here in Stilwell. It's a pretty rural community. I've been here for 25 years. I graduated in 2000 from Oklahoma State University and have been at this practice since then. So even though we do mixed animals, definitely have a special interest in small ruminants and especially goats. Started with boar goats and now we have mainly dairy goats. Mostly through the kids, but they've all about left, and so now it's me.
Yeah, that is story. Everybody.
Yeah.
Yeah. Okay, go ahead, please, with your PowerPoint presentation.
All right. So I will tell you, this is not my first Zoom meeting, but it's my first time as a presenter. So just if something goes wrong, just you guys guide me along what I should do.
Sure. You want to go for complete presentation? Yeah, that is good. Great.
Okay. So I think arms one of the things we do. I told you already a little bit about myself. I graduated from Oklahoma State, um, and then opened up this practice and just enjoy goats, and that's kind of how I got into doing more of that. So I was asked to speak a little bit about artificial insemination in goats and maybe guide people through that are interested in getting started at this. This is a pretty basic presentation, a lot for people that haven't done it yet but are very interested or are just getting started and need more confidence. I just saw a lot of people on the chat have been doing this for a little while, and so there's probably some tips and tricks and some new things, but there's going to be some of this that you've probably already heard. One of the reasons to consider AI is bucks are expensive. They can be a hassle. They get into things, they tear things up, they fight with each other. And if you have more than one breed like I do, you need a new buck for every breed of goat you have. So we currently have 4 different standard breeds of dairy goats. So we have 4 different standard breeds of bucks as well. So that, includes a lot of housing. AI is easy. The bucks stay in the nitrogen tank in the office and they don't ever fight with each other and they're super easy to take care of. And so that's one of the good reasons to use AI. Probably the main reason we got started with AI is you can progress your herd to breed standards and quality at a greater rate of speed than in purchasing bucks. You can tailor your breeding program based on what each doe needs to improve on. And so it makes it a lot easier to advance your program faster if you're looking to move up in breed standards and that sort of thing. It is not for everybody. It can get expensive. The success rates obviously aren't as good as natural breeding, and so you do need to have a backup plan. You probably should have a buck you can use or a buck you can borrow or lease for when AI doesn't work for particular does or in particular instances. There's certain times of the year it's not going to work as well. There's certain does that are just harder to get to conceive by something other than the natural method. And so it's good to always have a backup plan. But I do believe that everybody could AI their own goats and everybody could add some of these genetics that are available to their herds, even if they're thousands of miles. in heat. So you need to know a little bit about your does and how they cycle. They're going to come into heat every 18 or 21 days during their typical breeding season. Most of them are seasonal, so they come in as the days start to get shorter. Boers, Nigerians, Nubians, some of the others will have longer seasons, and some of them will actually cycle year round, which is kind of unique for milking does to be able to get milk year round and be able to freshen does year round. August to March is probably the prime time to breed most goats in this area where we live, with October to December being the most successful. And so when you're looking at AI and goats at the very beginning of the breeding season, they may not be ovulating properly. They may be short cycling a little bit. They may not be ovulating eggs as readily. And so early in the season, the first heats sometimes aren't as good. What you've done, it just maybe it wasn't a good cycle at the very beginning of the year. And then as you get further in the year, March, April, some of those are harder to catch as well, both with AI and with live cover. And so we don't try to AI a lot during the late time of the year just because it's discouraging when it's not working, and we don't need anything else, hindering what we're trying to do. Some things you're going to watch for when you're deciding about AIing your goats is the tail wagging is pretty classic. A lot of goats are noisy, especially if you have Nubians. Some of them will be mounting pins. They'll seek out a buck, and so most of our pins do have a buck fence line down to track what's going on. Also, if your goats have the long hairs around their tail, you can usually pick up a little bit of discharge, a little bit of matting hair, a little bit of um, things stuck on the hair that's not normal. And so when you see that, pay special attention to those goats because they're probably either coming in heat or having heats that are maybe not as evident. And so keep an eye on those. So when we're talking about breeding goats and using hormones to manipulate them, using different drugs you can get to cycle does, to breed at certain times, or to try to get everybody cycling at the same time, I think it's important to realize what the drugs or implants we're using are doing so that we can understand better how to use them. So if anybody's used CIDRs, those mimic the progesterone. So when we put a CIDR in, that is this top dotted line here where the doe thinks her progesterone levels are at this because of the slow release of progesterone from those CIDRs. And so when you pull those out, that progesterone level drops off. And so we're mimicking this effect right here when we pull that CIDR out. We can also give Lutalyse at that time, which is mimicking the prostaglandin. And so when we pull that CIDR and then administer Lutalyse, it mimics this prostaglandin release from the doe, which will cause this CL to rupture that should be on the ovary, and that will cause her to go ahead and progress into an ovulation. We also use a lot of PG 600, or we do when it's available, in does, and that will mimic our estradiol. And so over here, that is helping stimulate a ovulation from the doe so that she does actually release eggs. One thing about using PG 600 is it can cause does to release maybe more eggs than you want. And so I do not use that in regular cycles or regular breeding seasons. We tend to want to use that a lot more when we're trying to super ovulate a doe for, say, embryo transfer, or we're wanting to get does to ovulate out of season when they're not maybe cycling regularly. And so that allows a little more success when we're trying to ovulate does out of a normal estrus cycle. Cystorelin is going to work similar to PG 600 but it mimics LH as opposed to the estradiol. And so when you give Cystorelin, it causes those follicles to go ahead and ovulate. And so those are just some different drugs we can use to help assist us when we're trying to use artificial insemination. However, you actually don't have to use any of those. We breed a lot of does without using any drugs at all. We just go off of natural heats during the regular time of year. So that's always a possibility as well. And so these are some protocols that we use here when we're And that our first question probably should go out now. We
Okay.
use some of these protocols.
Do you want for me
Wait, do
to
you want me
go?
to wait for that?
You let
Okay.
you let me know the question. Do you want right now?
Yes, there's one question that goes here.
Okay. What drugs is that question? What drugs uh meaning
Yeah.
okay. We have 60% of the people that have answered already. When I get like 85%, I end 90% of the people. Do you want to give some feedback, please?
So yeah, I can do that. So the prostaglandin that causes the CL to rupture that's on the ovary is Lutalyse. And so that's a drug, that's probably the most common hormone that we use in reproductive manipulation of most ruminants and on occasions in a few other species. And so what that is doing is causing that ovary that has a corpus luteum on it or a CL to rupture so that follicles can develop and the doe can ovulate. And so that is the drug that we use. You can use it all by itself to cause does to come into heat and to be able to breed them. So the correct answer would be B, Lutalyse.
Okay, go ahead.
Let's see. There we go. So these are some protocols that we have used in order to get does to cycle or to get does ready to breed via artificial insemination. And so the CIDR protocol is where you use a CIDR, which is a vaginal implant. We put that in, you can leave it in. The days isn't near as important as the rest of the procedure, but usually 11 to 12 days is good. We try to always do more than 7. 14 is pushing it a little bit, but so if you're going to a show and do not want your doe to cycle, you can put these CIDRs in and leave them in until you get back to make sure she doesn't cycle at a show. So we put the CIDRs in. The day before we're going to pull that CIDR out, we give them a dose of Lutalyse. And so 1 to 2 cc's, higher doses for larger does, smaller doses for smaller does, obviously. And then on the next day, 24 hours later, we're going to go ahead and remove that CIDR and give either some PG 600 or some Cystorelin. And I would prefer Cystorelin, especially if you're doing this in season, because it doesn't tend to be as reactive to cause superovulation. PG 600 works really well for out of season to cause ovulation to try to make sure we get some eggs available. And the other thing with the PG 600 is it's often on back order currently. So that would be another reason that we just switch over and use Cystorelin. So then you can just watch the does, and as they come into heat, usually around 50 to 55 hours later, you can AI them. Now with the timed insemination, where maybe you're setting this up so somebody can come in and AI your dose for you, the 50 to 55 hours is a good time to schedule that. However, if you have the option to watch the dose, some are going to come in earlier, some are going to come in later. And so if you can breed them when you notice them in coming in heat, that will increase your odds of being successful. So it's okay to do that as well. However, if you're calling in a technician or a friend or the veterinarian, whoever's going to come over and AI your dose, this is where you could time it to have them come at a certain time and just AI everybody that you've set up. The Lutalyse protocol is one where I was saying we can use just Lutalyse to have does come in heat. We give them a cc of Lutalyse on day 1. Part of them will start to cycle. Anybody that's cycled within the last 4 to 5 days, they may not cycle again. And so that's why we wait and give another shot 7 or 10 days later And then that would make all of the does cycle at the same time if you would like all of your does pregnant on the same day. And so usually those does will come in 24 to 48 hours. We use this sometimes during season when we want to AI does on the weekend, or we have access to a certain buck we're going to use particularly on one day, and we're going to live cover. And so the Lutalyse is good to make a doe come into heat on a day you need her to be in heat, for our convenience. The other way is just watch for heats, and that's often how we start. We just are watching for does coming in heat, watching for buck does going to the buck pen. And there's a couple of ways you can do that. And probably what I do the most is if I see a doe in heat and I see her at the buck pen that morning, I will breed her when I get home that night. All other things we talk about later, as expected. If she's at the buck pen at night when we're out before we go to feed, everybody knows once you go to feed, they lose complete interest in everything other than food. And so kind of sneak around the barn or look from the windows to see who's at the bucks, who's wagging, who's mounting. If you see them in heat that night, that evening, then we would go and breed them the next morning. So that's the 12-hour rule, or the AM PM rule. You can also give those does you see in heat a dose of Cystorelin to ensure that they are going to go ahead and ovulate when you AI them. And so if you see a doe in heat, you can give her Cystorelin, wait about 8 hours, and breed her, and that just helps to push things along, and hopefully that she goes ahead and ovulates those eggs for your AI to be more successful. The other thing, and we see this with some does, is if I see them in heat in the morning and I come back to AI them in the evening when I'm home again. So the AM PM rule works really well for somebody that works away from home. You see them in the morning, you see them when you get off work, but you're not really seeing them any other time. And so that works well for me, unfortunately, because I am not seeing my goats very much other than those 2 times. But if I get home and she was in heat that morning, and I get home and she's still really interested in the buck, and she's standing over there and she's wagging her tail, she's probably still in too strong of a heat. We would check her with a speculum, but most likely we would wait until the next morning or even later that night, late at night, to do her. Because the ideal time is when a doe is still in heat, but she's not necessarily standing at the buck. And you can kind of tell this watching the does, because they're trying to decide if they want to go back to the herd, or they want to go back to the hay bale, or do they want to go back to the buck. When they're in strong heat, they stand at the buck. They have no question. As they go out of heat, they go back into the herd and they don't come back. But when you see those does trying to decide if they should walk which direction, those are the does that are kind of prime candidates for an AI when you're just going off a natural heat. So watch for those. So I have a couple of slides in here about the semen tanks and handling the semen. And I'm probably going to go through those kind of fast because I feel like the other part of this is probably a little more important for our group. But the main thing is, if you have a semen tank or you get a semen tank, just do your research. Make sure you understand how they work, the canisters, the that are inside there, the way you get those in and out, the way you move the goblets around to get straws. Just some pointers I would say is always notice where your frost line is when you're looking down in your semen tank. Try to keep your straws of semen always below that frost line. Usually I hold a flashlight to be able to see down in there. Try not to hold any of those goblets of semen above that frost line for more than 10 seconds. So until you feel comfortable doing that, you can just count while you're working and then drop them back down in there to make sure they stay cool. The other thing, when you're done AIing your doe, do not lose the straw. It has valuable information that you'll need to register babies later. And so if you're doing this for registered goats, hang on to that straw. And I actually cut the sheath off at the length of the straw, because if you pull the straws out and just hang on to them, after a while some of that printing will wear off of them. So I leave them in the straws to protect that printing that's on those straws for a while.
Dr. Burton, do you want for me to poll the next question?
Yes, see, I knew I would forget you. There is another question.
Okay. Question two. How soon after those noticing hits would you breathe on AM/PM schedule? All the people is very smart.
Yes.
Do you want to give feedback?
Okay, yeah, very good. So typically, if you're doing an AM PM schedule, when you see a doe in heat in the AM, you are going to breed her in the PM. So if you check her at 6 in the morning, you will breed her that night when you get home at 6 p.m. And so every 12 hours is when you would do that. That's a generalization. There are some reasons you would wait to breed her, or even breed her early if you had to. And so, but as a general rule, if you're able to check your does twice a day on an AM PM schedule, when you notice a doe in heat, you're going to try to breed her 12 hours later. And and on that also, when if I breed a doe, she looks like I need to breed her on that 12-hour schedule, and I breed her that evening, because everything else seemed right. If I wake up the next morning and she is still interested in the buck and she still seems to be a little more in heat than I would expect her to be, I will go ahead. If it's a straw of semen that you're okay putting another one in, I would put another one in the next day because I would rather it work. I would rather use two straws and it work than use one straw and it not. And so there are a few exceptions to that, but very good.
Okay, go ahead.
Okay. And then this just shows an example of some of the inside of the tank, the way they sit down in here, the reason they're so hard to get in and out. And so just understanding those is important when you start handling the semen. Mainly because when you're first starting out, it can get a little stressful when you're trying to move those around and thinking about getting those straws out. And so your semen straws set inside these little goblets, and your goblets click on the canes, and the canes fit down in the canisters. And so just some information for when you're ready to start purchasing the semen. So as far as the equipment you're going to need, there's multiple different ways to do this, and I can tell you that probably the best way is the one you get the most comfortable using yourself. And so there's many different types of guns. This is an O-ring gun, and so your sheath slides on the gun, and then this little yellow piece here slides up on the gun and kind of locks it into place just by pressure. And so this is the gun I currently use the majority of the time, is the one with the yellow O-ring on it. There's also what they call twist-on guns, and so those guns have a coil at the top of the gun there, so that when you put the sheath on, you just twist that on there, and it almost forms like a nut and a bolt sort of a action to where it holds the sheath on for you to keep that sheath in place while you're AIing your doe. It's kind of hard to see, but in this sheath, you can see the little insert up here at the top. Um, and I really prefer sheaths that have those in those, because those inserts, when you click your semen straw into your gun and you can hear and feel it click into that insert, that guarantees that there's not as much flow back into your sheath when you're inserting the semen into the doe. And so I really prefer those sheath. I can tell you, since I do cattle and goats, I only buy cattle sheaths because they fit on both the goat guns and the cattle guns. I've used my cattle guns in some boar goats because they are really big and the goat guns aren't quite long enough. But then on the sheaths, I just cut them down to the length I need them for the goat guns. And so I think they're even a little cheaper to buy the cattle sheaths for the goat guns and cut them to length. When I started out, I used what was called a needle gun, and now they have pinnacle sheaths that kind of mirror the needle guns. And so it literally had a little glass rounded needle that would slide into your semen straw and then slide into your needle gun. And I thought it was really easy to use. You had a nice, like, beveled edge to get into the cervix, but they don't make those anymore, or I can't find them. And so I've just learned how to use something else, even though I thought they were really nice. The drawback to them was there was a fraction of your semen that would be left in that needle after AIing, and so everybody knows how valuable that stuff is, and nobody likes to see it left behind after you get done. So what I would suggest when you get your AI equipment and you've got your guns, have some empty straws or get some empty straws from friends that have been doing this, and just practice putting your gun together with an empty straw, semen straw, until you feel comfortable doing that. Once you feel comfortable putting that together, when you're under the pressure of this dose and heat and I need to go get some semen, it won't seem as intimidating to you. And so as a new person, once you get your equipment, I definitely recommend practice putting it together and the order you're going to put it together in, um, multiple times with an empty straw so that you feel good once the time comes to do that. The next piece of equipment you're going to need is going to be your speculum, and that's what we're going to use to visualize the cervix and the mucus within the vaginal tract of the doe. And so I use a couple of different ones. There's PVC pipe speculums, and we make these ourselves out of hot water pipe in various diameters. Of course, Nigerians or yearlings need a smaller diameter. Um, Standard does can go up in diameter. And so various sizes you can get for that. And then we just, on all of my PVC pipe speculums, they are beveled on the end, and so they work really good for maiden does. They work good for does that are small. They're easier to insert into the vulva without as much pressure. My favorite speculum is probably the glass speculum, which is this bottom picture here. And that is simply because when I'm using a glass speculum, um, there's a lot of light reflection, and so it really brightens up what you're seeing inside. Plus, you can see through the glass to see the color of the mucosa or the color of the mucus on the outside of the speculum. And so I find those really handy. They're not as easy to find, but we have a very good friend in the dairy goat world that makes those, and I really like them. I have two sizes. There's a standard size and a Nigerian size, which I also use on yearlings. There's duckbill speculums, which I myself am not a fan of. I know some people use them. They seem to work good in does where you're wanting to also insert maybe a sponge forceps to move that cervix around. I would say you need to do that very rarely. And so for me, I can do most everything I want to do to a cervix with the tip of my AI gun. So I always use a glass speculum, unless I have a really small goat, and then I'll use a beveled edged PVC speculum. Lights, there's a lot of lights out there to use inside your speculum. And the main thing is trying to find the smallest pin light that will fit in there that has good visualization, that is bright, and that you're comfortable using. I like battery operated ones. They also have some that have a wire from them and go to a battery box. You can put that in your pocket. You can lay it on the stand beside you. But finding a light that fits in your speculum, and I would always recommend having two because it never fails. A light is going to go out right when you need it to be on, and so always have two available in your um, toolbox for AI and goats. And then I think this is where we need to ask our equipment question.
Okay, I will go. I guess this is one.
Yeah. All right, very good. So most of you said the forceps. That is true. You should not need forceps of any type when you're AI in your dough. You're going to use your speculum to visualize the cervix. You're going to put your semen straw in your AI gun, and then your AI sheath will go over your gun in order to inseminate your dough. So perfect. So this is where it comes to artificial insemination. But honestly, if you can get your timing right, you can be an average at everything else. And if your timing is right, your chances are going to be increased. And so you want to make sure the doe has ovulated. You want to make sure you're AIing her at the right time. You want to be at the end of standing heat where the doe isn't quite as interested. And you can do that by watching the doe or by manipulation with medications. But we want to be at the end of that. The egg is only going to live for 12 to 24 hours. And so we have to make sure we get our sperm in there at the appropriate time to have a conception. When you're using fresh sperm, it typically lasts, so you're doing a live breeding, that sperm is typically going to only last 1 to 2 days in there. And so the buck could breed her a little early or at the end and still be okay. When we're using frozen semen, it's not lasting near as long, and it has a lot to do with quality of the semen and how it was processed. And so you don't have quite the same time frame as with fresh semen. And so we will make sure our timing is as close to accurate as possible. When you look in, when a doe first comes in heat and you look in there at her cervix, there's not going to be a lot of mucus present, but it will be a nice bright pink color inside the area. And then as the heat progresses, her mucus is going to go from a transparent or clear look to a more of a cloudy apparent look. And then as it goes through, it starts to thicken up even more and turn a white or even cheesy solid look to it. And so what we want to do is AI this dough when it's a nice, cloudy, viscous, stringy look to it. And so it should be thick, it should be sticking to things, but it shouldn't be clumpy like, let's say, cottage cheese or something like that. We have some pictures. And so I'm going to go through some pictures and then we're going to do our next question. So this is a picture, when we took the speculum out, this is some mucus that was stuck on the end of the speculum. And actually that is the back of a PVC pipe speculum. And so when we put the speculum in, that mucus ran all the way down to the end. And as it came out the back, it's not dripping, it's not falling off the speculum. And you can see the fingers there. When we grab it, it just stretches like taffy. And so that's really nice, cloudy, stringy, thick, viscous mucus. And that's what we like to see. I would AI a doe with mucus like that. Here you can see some more mucus inside this speculum. This is the glass speculum, and that mucus is cloudy. It's hanging down. It is still running out of the speculum, but it's not dripping off. So that is a nice stringy mucus that you would want to AI this dough. This is getting a little far along. It's pretty dark, pretty white. You can see it's really clumped up on the speculum here. And so that's getting to be thick, but it's stringing a little bit. And does are different. Some does I can AI at this stage, and we have one particular doe that when you AI her at this stage, she does really well. This isn't the normal look I would be looking for. I would be nervous this doe was too far along. And then here is some of that white, almost butter thickness, really not transparent mucus that is in the speculum there. This doe has probably gone out of heat. Like I would not expect this doe to get pregnant. And so now we have a question about AIing does and their mucus.
Okay. It's like when it's clear, when it's cloudy, when it's white. Yeah.
Okay, yeah. So what we want to do is when you notice that mucus start to turn that cloudy, stringy, viscous color, that is when is a more ideal time to AI these does. When you first, if you're checking does, and I advise people that are new to this to check your does. When you see them coming in heat, put your speculum in and have a look at the mucus that's in there because you'll see it or it will be in your speculum when you pull it out. And you'll notice at the very beginning of her cycle, it is pretty clear. And then as she goes along, it starts to change colors. And then after they are less interested in the buck, not as in heat, starting to go out. You'll notice this white. Pink mucus is never good. I wouldn't AI a doe with pink mucus. Usually that would be from red blood cells that's intermingled with her mucus. That can signify an infection, or maybe the speculum was too rough getting it in there, or the doe had something else going on. And if everything is okay, there's no problem in AIing her. But blood cells are toxic to sperm, and so if you get too much blood in there, if everything's too pink, your chances of success just aren't as good. So we want to AI those does when the mucus is nice and cloudy. Okay, I figured I would talk too much. I'm going to try to hurry through. So here is a picture with a speculum in a doe. You can see, I think you guys can see my pointer. This is okay, this is the light right here that's clipped onto the side of my speculum. This yellow arrow is pointing up the cervix. And so when you're AIing, this is what you're looking for. And we've got that speculum seated right on top of that cervix to kind of hold it still with just gentle pressure. But this is the cervix opening right here that you're going to want to put your semen gun or your insemination gun into. And you can see a little bit of this mucus right up here at the top. That's a nice cloudy color. That's what you're looking for. It's nice and bright pink in here. And so this is a nice demonstration of a cervix and a doe that we would go ahead and stick some semen in. Here's another picture. You can see the cervix is right here in the middle. This doe was probably a little easier to inseminate. Her cervix is a little more swollen on the edges. This opening is a little larger right now. There's a lot of this white mucus, and this is that glass speculum where you can see the color all around of the vaginal canal, and you can see the mucus that's on the outside of the speculum. It's a really cloudy color. But it's not clumped up on everything. And when we pull the speculum out, this is still a stringy, viscous mucus. And so we would go ahead and AI this doe. And here's the light right down here that's clipped on to the side of this speculum. So now you're ready to AI your doe. And so the main thing is be sure to lubricate your speculum well. But don't over lubricate it. You don't want a bunch of, even the non-spermicidal lubricant, you don't want it in the way, and you don't want it just sitting in there when you're done with your insemination. And so what I do is put probably a dime-sized dollop on the back of my speculum. I rub it on the doe after cleaning her off real good, and then twist my speculum to help it go in to the vaginal area easier. Go slow, be gentle, don't force it. It just takes a little bit of gentle pressure sometimes. Those maiden does are going to be harder to get into, and that's where you want to use either a beveled speculum or a smaller speculum to get that going. I try to always, when I have time, to visualize the cervix before we go and get our semen to AI these does. And so go out if you think you're going to get a doe and you have help. I bring the does in, we put them on the stand, I check the cervix, I check the mucus. If everything looks good, I actually have my helper, which is normally one of my children, stand there and stand with the doe on the stand and hold that speculum in place until I get back so that I don't have to reinsert that and worry about reintroducing any sort of dirt or pathogens or anything like that. And so we really try once we put a speculum in to leave it in until we're done if we're going to AI that doe. You can try to insert the sheath before you get your semen loaded if you want, if you're really nervous, and see how you feel about that. But at the same time, I'm a firm believer that once you have your semen loaded in your gun and your gun is loaded in the doe, you have time to do that because the temperature inside that doe is the temperature you need it to be. And so that, I think it's perfectly fine if you're ready to AI that doe, go ahead and go get your supplies and come back. So once you visualize the cervix and you've got it locked in with your speculum, you're going to insert and guide that through visualization. So different from other species, you're actually watching what you're doing down the speculum. You're going to guide it into that cervix, feel it going through those rings of the cervix as it advances. Some does are definitely going to be harder than others. As you're starting out new, you're going to feel like you're probably never going to get it right. But just my suggestion is just keep trying, just keep AIing does. And when you start to feel those pops and get comfortable with how to move and manipulate that gun inside the cervix, you'll get better at what you're doing. And definitely, if you stop trying, you will never learn how to do it. So my opinion is you should always just keep AIing does because that's the only way you're going to learn. If you were advancing through the cervix or what you feel like is the cervix and you're not feeling that popping of the rings, then one of two things is happening. Either this doe is really open, her cervix is really dilated, and so you're not feeling the rings. That can happen especially in older does that have kidded multiple times. Um, and that's not a problem, but it's just something to note in older does. Or also you can get beside the cervix. It feels like you're going through the cervix, but you're beside it and just going into that fornix vagina where there's actually nothing down there, and that would be one of the really undesirable places to deposit that semen. When you get your gun on the tip of that cervix and you're feeling a little bit of pressure, a lot of times I will just do one drop of semen. I will just inject just a little bit of semen as a lubrication inside that cervix. And so sometimes that's just enough of a liquid in there to go ahead and allow you to advance through a few rings. 2 or 3 rings is really far enough. You don't need to advance through all the rings of the cervix. You don't want to deposit in one horn or the other. So once you get through a few rings of the cervix, go ahead and stop and start slowly injecting your semen. Keep watching through your speculum and make sure you're not seeing semen come out around the cervix. If you do see semen coming around the cervix while you're injecting, just kind of reposition a little bit. You may have pushed your gun up against the wall of the cervix. You may be off to the side of the cervix. And so if you're seeing semen, just kind of reposition. Um, then gently and slowly just start to remove the equipment once you have injected all the semen from your gun. So if how do you know if it worked? The main thing's going to be in 18 to 21 days. If the doe doesn't come back in heat, she may be pregnant. If she does come in heat, unfortunately, she is not. At 28 days, you can do a blood test. You can also, a lot of people have their ultrasounds now, and so you can also ultrasound and start looking for pregnancies that way. The good news is, even if you felt like you did nothing right, it could still work. You have put semen in the dough. If there were swimmers in your straw when you put it in, then there is the possibility that you could get a pregnancy from that. One thing we do is we have a microscope at our house, and when I thaw a straw of semen, I always put a drop on a microscope slide to check for viability before I go out there. I don't want to spend all my time doing this and have put an entire straw of dead semen in. So I like to see swimmers in my sample before I go out to the doe. And so I really, and the other good thing about that is that rules out all of the questions you had of was it me, was it the semen, was it the doe? If you check your semen before you go to the doe and know it was viable, then you can be confident that it was not the semen if it didn't work. And so that's a good thing. The main thing to note about that is the very first drop of semen, like the semen that's up against the cotton stoppers in the semen straws, sometimes that is not the most accurate sample. So on occasions, you may need to do a couple of drops. And I think we talked about the drugs quite a bit, and I think I'm running out of time. Let me see. We talked about how to use the drugs. Um, and there's multiple ways to stimulate does to come in heat without drugs. And so there's using the lighting system where we try to make their days long and then we make them short. That takes a couple of months. And so that's the sort of thing that if you want to do that, you need to start in like December or February to induce that artificial heat cycle in order to breed in April through June. Bringing them bucks in rut, which can be challenging because bucks also can be seasonal in when they want to breed. And that is just my 4 girls and one of the reasons I do what I do and what got me started in this. And so they are still my inspiration. And I talked a little longer than I was told to, but now I'm happy to answer any questions. Um, and then this is my email. This is actually my cell phone number as well if you would like to text me. And those are my 3 Facebook pages if you want to find me there. So I I can talk about goats forever with anybody that wants to talk about goats. So,
Um, Dr. Burton, thank you so much for your presentation. We have a few questions. I have listed those questions. If you are okay, I can start the questions. Is that okay?
okay. Yes.
Yeah.
Yes. Sounds perfect.
Yeah. What is the success rate of AI in sheep or in ewes that are flushed well? What is the success rate? Yeah.
In ewes and sheep,
Mhm.
is that right? So,
Yeah.
just regular transvaginal artificial insemination in sheep is not very good. Typically, with that, you're going to have to do lap AI or embryo transfer or something like that, just because sheep, the shape of their cervix is much harder to inseminate. And so we don't see a lot of that done. I think if you're wanting to artificially inseminate your sheep, probably the best thing to do is schedule that lap AI for those to have much success at all. I would probably put it 20%. It's just sheep are very hard to artificially inseminate just on a stand transvaginally.
So, so, what alternative do you use if a PG600 is not available?
So if I am not a huge fan of PG 600, unless I'm doing out of season breeding, and then if I don't have it available or cannot find it, I would use Cystorelin to try to cause those does to go ahead and ovulate. Um, we use it when we're setting up the timed protocols and that sort of thing, especially if we're doing something out of season. But when it is
Mhm.
unavailable, it is really hard to find something else to use. Um, PMSG used to be available, but I think that one is even harder than PG 600 now. And so if I just can't get PG 600, then I would move. 600 is not a huge um, something I like to use a lot is because it can cause superovulation. And so in does that are carrying 3, 4, or 5 babies, you run a higher risk of pregnancy toxemia. They have to be managed a lot more stringently than the other does that are carrying singles or twins. And so in especially in something like Nigerians or in boars that are more susceptible to pregnancy toxemia, then using PG 600 when you're in season, then they're already ovulating regularly, that increases their chance of having a lot of babies.
That is the reason you
Um,
said that you use it when it's out of the season. Yeah.
yeah, thank you, Dr. Burton. So it looks like PG600 is not available in the market these days. Do you know when this will be available again?
I do not. It seems the last few years, it seems PG 600 has kind of scoop on that of what's going on with it than anybody else. We just have to wait until a supplier calls us and tells us they have it. When we do have it and we mix one of those bottles up, once you
Mhm.
mix them, you do need to use them fairly soon. And so what we do is we freeze them in increments in syringes with an air pocket in it to make sure that we're not wasting the that we do get. And then we just thaw it at room temperature when we need it.
Thank you. So there is another question. It is regarding to the protocol that you presented. On that protocol, that Lutalyse 1 cc Lutalyse or PG600 1 cc, is that 1 cc for all the breeds or even Nigerian dwarf breed?
So we didn't get into a lot of discussion about the drugs and dosages. And one thing to really keep in mind is, unfortunately, none of these drugs are approved for use in goats.
Mhm.
And so there are no labeled dosages for them. That being said, we can use them off-label in goats to when there's no other drugs that are going to do that for us, as long as it's not for performance enhancing reasons. Unfortunately, there's people on both sides of that that says we're trying to performance enhance them in a reproductive. way. And so some people feel like that is not legal. Some people feel like it is. But ultimately, when we're using it and the dosages we're using, you're going to find a lot of different variables out there. What I would do in my practice, because I understand the importance of these hormones. However, I am more cautious when dosing them. So I would use 1 cc in most standard size dose, and the half a cc in like a Nigerian or a pygmy.
Sure.
When I would go up to 2 cc's would maybe be out of season or in does that are really big, like 250 pound does. We see that in some of these larger dairy goats or in some of these really large boars. You may go up to 2 cc's, but an average 120-pound goat, I would use 1 cc.
Sure. So so the remaining questions are on the chat list, the last question. So how often should I fill the nitrogen tank? And I fill it when my tank ruler reads less than 8 inches.
Okay, so yeah, so if you have a tank and you're having it filled, typically the rule of thumb I try to stick with is 11 centimeters. Because my ruler I have is on centimeters. However, what I have found for me, my best option is I'm on a schedule, and so somebody drives through I think it's like every 10 or 11 weeks and fills our tanks. Every tank is going to be needed to be filled at a different time based on how long its hold time is, and so you can't really put it in days, but you do need to measure it every week or every couple of weeks until it starts to get lower, and then every week. And 11 centimeters is my go-to on that.
So what's your success rate in AI in your farm?
Okay, so it's really varied because I'm going to tell on myself here. I'm definitely a semen hoarder. I have 4 semen tanks in my barn, and I have at work, and I have a probably 350 straws stored at a facility that I could go get if I were ever to run out here of different bucks. And so because I have so many straws available to me, I inseminate my goats all the time. Even if it's maybe not ideal, I will put some in there because I have extra straws to use, and I really love to see these babies from AI produced. It's really cool to see what you can get. So for my success rate in my herd, I would say it may be a little lower because I AI a lot of goats just for the fun of it, and because I have a lot of semen available to me. When I'm AIing goats for clients, that's a little different because we're doing it more on a schedule. I would say my success rate with my good clients, clients that can recognize when a doe is in heat and knows when to bring it to me, is probably between 70 and 80%. Um, there are times when I'm AIing for clients that maybe have a harder time telling when the doe is in heat or telling what's going on when I ask them, and so they're having to drive back and forth a time or two. So it kind of goes down. This goes back to that timing is everything. So your success rate is going to depend on your timing. And if your timing is dependent on somebody else bringing the goats to you, that kind of affects that too. So,
This might be the last question. How long does a PG600 last in the freezer? I mean, that expire. How long does that expire?
so that's another thing that we really don't know for sure because it's not something that is that the manufacturer is going to suggest you do, and it's not something that has been studied. But I would say typically that season. Like I would freeze it and use it that season. I would not hold it over for another year.
Sure. Um, what type of thinners do you use for the straw?
I see that. What type of, I'm not sure I understand that question.
It might be sheath or could it be sheath? I don't know.
Yeah, I see that there. I'm not sure. What type of thinner do you use for the straws? Maybe thaw? Like how am I thawing my straws? I saw somebody else asked that question. Um, So technically, the proper way to thaw a straw of semen is to take it out of the nitrogen tank, clean the frost off of it. Always check to make sure you have the semen you think you have. You're putting the proper species in the proper species. If you have a tank like mine that has various things in it, and you're putting the breed or the buck you want to use in the doe that you have caught. Um, put it in a water bath at around 96 degrees for about 30 to 45 seconds. Pull that out, and you should have a nice thawed sample of semen. When I'm AIing, I have to walk a long ways to AI goats from where my semen is stored. So I actually body thaw, which I take it out. I will usually thaw it under my arm, like we would a thermometer. And then take it to my microscope, put a drop on. I can watch it as it's heating up under my light. I see the semen is moving, and then I put it back under my arm to finish thawing it as I walk to the barn. And so I do a body thaw, which I saw somebody say something about earlier, which your body temperature should be right about the temperature you need to thaw a straw of semen. One thing to keep in mind is when you're thawing semen, it's this super cold number in the tank, and you pull it out and you want it to get to the body temperature of the goat. As long as we're always going warmer, we're good. If you ever get warm and then go back cold, say you walk outside in weather like we've had last week, and that straw is exposed in that gun and the wind is blowing on it, you're probably killing that semen. You have to protect it. You always have to keep it warming or warmer than it was. And then I see this one here. To clarify, we AI goats and embryo transfer to sheep or embryo for goats. So goats are pretty flexible. You can transcervical AI them like we're doing just on a stand, like you can do in your milk room at home or on your grooming stand. AI, goats are really good at that. You can also do the other. You can do lap AI with goats if you have really expensive semen that you want to feel more confident about. You can do embryo transfer. You can do IVF. With sheep, the only thing we're having to skip is that transcervical AIing that maybe producers or less experienced people are doing, because it's just a lot harder to get through a sheep's cervix. And so you can do all the processes with goats. You will have better success rate if you skip the transcervical AI in sheep and just move on up to the next process of lap AI or ET with sheep.
Okay, I think we are on the time, and so thank you so much, Dr. Burton, and so for all the people here, we have a lot of questions, and we are going to share any questions if later on we receive it. We appreciate your participation, and we are going to keep going on, I think, for at least 3 more talks here for the certificate. So thank you so much, and we appreciate your participation, Dr. Burton.
Yeah, I truly enjoyed Dr. Burton. I really like this topic.
Thank you. Yeah, it's super exciting to me, and that's why I just, I love to talk about goats, but I love to talk about AI, and we love to AI goats just because it's really cool. What I'll do is I'll email you guys the PDF of the presentation. That way, if anybody didn't get to save any of the slides or anything or any of that information, you guys will have that.
Yeah, would be
Thank you
very
so
good.
much.
Yeah, thank you so
All
much.
right.
Okay.
Thank you.
Yeah, see you.
Bye bye.
Thanks, everybody.